So this is just a very crude example of what a hip replacement entails. This is your natural hip, and this is the ball of the hip joint. This is the socket of the hip joint, and in a natural hip, the ball moves within the socket like this. As when you're walking, when you're sitting, and when you're running, it's moving faster. It has a limited range of movement, much less compared to the shoulder. However, in diseased situations, the ball is not smooth anymore, the socket is not smooth anymore, and as the ball moves within the socket, there's a lot of friction, there's a lot of pain. So what we do is during surgery, we approach the hip joint, we dislocate the ball, and we remove the ball from here through the neck of the femur. Okay? So when we do that, the femur looks like this, okay, without the ball. And there is a socket, there is a bone is a tube, so there's a lumen through which we can prepare what we call the femoral canal using various rasps. That is the technical term used, and we find the right size of the lumen of the femur, and then we put a stem which fits the patient. That's some stem. You put a ball on top, and on the socket side, we clean the socket again with specialized spherical reamers, and we measure the size of the cup, and we put the same sized cup, which is actually made of titanium, into the socket. This is a liner which is made of polyethylene, but it can also be made of ceramic. This is a ball which is made of ceramic or a metal. So when the two come together, there is a smooth surface here, there's a smooth surface here, and the ball and the hip joint is restored, and the patients can walk smoothly without pain once again. Okay, so this is in summary a hip replacement procedure.